The liver, our body's biochemical powerhouse. It's responsible for detoxification, metabolism, and essential protein synthesis, working around the clock to keep us alive. But what makes the liver so unique? The liver receives two separate blood supplies, making it highly resistant to damage. Or that its Kupffer cells act as first-line immune defenders, clearing toxins and pathogens from the bloodstream. And here's something even more fascinating: the liver can regenerate itself, even if up to 70% of its tissue is removed. A deep understanding of the liver is crucial for interpreting lab tests and diagnosing liver disorders. In this video, we'll explore the macroscopic and microscopic anatomy of the liver, the biochemical pathways that regulate metabolism, detoxification, and bile production, the clinical relevance of liver function tests, LFTs, bilirubin metabolism, and bile acid regulation. By the end, you'll have a comprehensive grasp of liver function from a laboratory perspective, essential knowledge for ASCP exam preparation. Let's dive in. The liver is the largest internal organ, weighing approximately 1.2 to 1.5 kilograms in adults. It is located in the right upper quadrant of the abdomen, just beneath the diaphragm, and is protected by the ribs. It is held in place by ligamentous attachments, including the falciform ligament, which divides the liver into the left and right anatomical lobes. Additionally, two smaller lobes, the caudate lobe on the posterior surface and the quadrate lobe on the inferior surface, contribute to the liver's structure. Blood supply and drainage. One of the liver's most remarkable features is its dual blood supply. It receives approximately 70% of its blood from the portal vein, which carries nutrient-rich blood from the gastrointestinal tract and spleen. The remaining 30% comes from the hepatic artery, which delivers oxygenated blood. These two supplies merge in the sinusoids, where they perfuse hepatocytes before draining into the hepatic veins, which ultimately empty into the inferior vena cava. This dual supply makes the liver highly resistant to infarction, a characteristic unique among major organs. The Glisson's capsule, a fibrous layer surrounding the liver, provides additional structural support and protection. Biliary system. The liver is also integral to bile production and excretion. Bile is produced in hepatocytes and drains through a network of bile canaliculi, merging into intrahepatic bile ducts. These ducts ultimately form the right and left hepatic ducts, which exit through the porta hepatis and combine to form the common hepatic duct. From here, bile can either be stored in the gallbladder, via the cystic duct, or travel directly to the duodenum through the common bile duct. At the duodenal entrance, the sphincter of Oddi regulates bile release, preventing reflux of intestinal contents. Microscopic structure. At a microscopic level, the liver is composed of functional units called acini, which are arranged around the portal triads. These triads contain branches of the portal vein, hepatic artery, and bile duct. Blood flows through the sinusoids, lined with fenestrated endothelial cells and Kupffer cells, which play a key role in immune defense by clearing toxins and pathogens. Hepatocytes, which constitute 70% of liver mass, perform most metabolic functions, while stellate cells store vitamin A and contribute to fibrosis in chronic liver disease. This intricate anatomy enables the liver to perform its essential metabolic and excretory functions efficiently. Biochemical functions of the liver. The liver is not just an anatomical structure, it is a biochemical powerhouse that regulates metabolism, detoxifies harmful substances, and ensures the excretion of waste products. It plays a central role in maintaining homeostasis, processing macronutrients, breaking down toxins, and eliminating metabolic byproducts. The liver's biochemical functions can be divided into three key areas. 1. Metabolism of macronutrients, regulating carbohydrates, proteins, and lipids. 2. Detoxification and drug metabolism, neutralizing toxins and metabolizing pharmaceuticals. 3. Excretion and waste elimination, clearing bilirubin, bile acids, and other byproducts. Hepatic metabolism. Carbohydrate metabolism. The liver plays a critical role in glucose homeostasis, ensuring that blood sugar remains within a stable range. It achieves this through glycogenesis, storing excess glucose as glycogen. Glycogenolysis, breaking down glycogen when glucose levels drop. Gluconeogenesis, synthesizing glucose from non-carbohydrate sources like amino acids and glycerol. These processes are tightly regulated by insulin and glucagon, responding to the body's energy demands. The liver's ability to rapidly switch between these states is crucial, especially during fasting or prolonged exercise. Protein metabolism. Hepatocytes play a vital role in protein metabolism, producing key plasma proteins such as albumin, maintains oncotic pressure and transports hormones, drugs, and fatty acids. Clotting factors, including fibrinogen, prothrombin, and factors 5, 7, 9, and 10. Acute phase proteins, such as C-reactive protein, CRP, which is involved in inflammation. Additionally, ammonia, a byproduct of amino acid metabolism, is converted into urea via the urea cycle, preventing neurotoxicity. Impaired liver function can lead to hyperammonemia, which contributes to hepatic encephalopathy. Lipid metabolism. The liver plays a central role in lipid regulation, including synthesis of lipoproteins, LDL, HDL, and VLDL, which transport cholesterol and triglycerides. Production of bile acids, which facilitate digestion and absorption of dietary fats. Fat storage and mobilization, storing triglycerides and breaking them down for energy when needed. Dysregulation of lipid metabolism is associated with fatty liver diseases, including non-alcoholic fatty liver disease, NAFLD, and alcohol-induced fatty liver disease, AFLD. Detoxification and drug metabolism. The liver functions as the body's detoxification hub, processing both endogenous and exogenous toxins. This occurs through Phase 1 and Phase 2 biotransformation reactions. Phase 1 reactions, oxidation, reduction, hydrolysis. Mediated by cytochrome P450, CYP, enzymes, these reactions chemically modify toxins, making them more reactive for further processing. Phase 2 reactions, conjugation. Phase 2 reactions involve the addition of hydrophilic groups to toxins, making them water-soluble for excretion. Examples include glucuronidation, conjugation of bilirubin, acetaminophen, and other drugs. Sulfation, detoxification of steroid hormones and neurotransmitters. Acetylation, metabolism of drugs like isoniazid. Many drugs undergo first-pass metabolism in the liver, significantly altering their bioavailability. This is particularly important for medications like warfarin, statins, and opioids. Excretory function. Bilirubin metabolism. Bilirubin is a byproduct of heme degradation from aging red blood cells. It is processed in 3 major steps. 1. Unconjugated bilirubin binds to albumin and is transported to the liver. 2. Hepatocytes conjugate bilirubin with glucuronic acid, making it water-soluble. 3. Conjugated bilirubin is excreted into bile and ultimately eliminated in feces. Disruptions in bilirubin metabolism lead to jaundice, which can be classified as prehepatic, due to excessive hemolysis, e.g., sickle cell anemia. Hepatic, from liver diseases, e.g., hepatitis, cirrhosis. Posthepatic, from bile duct obstruction, e.g., gallstones, tumors. Bile acid synthesis and recycling. Bile acids, synthesized from cholesterol, play an essential role in fat digestion and absorption. They undergo enterohepatic circulation, meaning they are reabsorbed in the ileum and reused multiple times daily. Disruptions in bile acid metabolism can result in cholestasis, impairing digestion and fat-soluble vitamin absorption, A, D, E, and K.